Hi everyone. Today we will discuss about a condition which is known as osteoporosis. What is osteoporosis? Osteoporosis is a condition in which there will be a progressive loss of bone which leads to decrease in the density or the thickness of the bone, which results in weakness of the bone, and the bone will become very fragile and brittle, so that even with minor falls the bone will easily get fractured. What are the reasons for the development of osteoporosis? There are various reasons. Let us discuss about some of the major reasons. Number one, menopause. Menopause happens in women greater than 45 years of age, in which there will be a decrease in the level of the estrogen. Estrogen is responsible for the maintenance of the density and the structure of the bone. So whenever there is a decrease in the level of the estrogen because of the menopause, there is a possibility of developing osteoporosis. Number two, sedentary lifestyle. Sedentary lifestyle is a lifestyle in which people are having less physical activity or physical participation that exerts very less load on the bone, that leads to decrease in the development of the bone forming cells, that is osteoblast, and that's how it leads to development of the osteoporosis. The next reason for the development of the osteoporosis is lack of nutritious diet. So minerals such as calcium is responsible for the development of the bone, and vitamin D is responsible for the absorption of the calcium. So diet which lacks the calcium, vitamin D or vitamin K or magnesium, zinc, all these things are responsible for the development of the osteoporosis. And the last and the major reason is consumption of the steroids. Consumption of the steroids for greater than 3 months and large doses of steroids causes suppression of the activity of the bone forming cells, that is osteoblast, so that there will be a decrease in the density of the bone, that is osteoporosis. So what are the clinical features of osteoporosis? Because of the decrease in the density of the bone, there will be a decrease in the height of the vertebral column, and that's how there will be a decrease in the height of the person. So loss of height is the main clinical presentation of osteoporosis, and there will be back pain because of the weak and fragile bone. That is another clinical feature. And the next clinical feature is there may be an abnormal posture, like forward stooped posture will be there because of the decrease in the density of the bone. And in most of the cases, there will be development of fractures, especially vertebral fractures will be there because of osteoporosis. What are the interventions for osteoporosis? When we talk about the conventional interventions, we have weight-bearing exercises and resistance training. When we do weight-bearing exercises such as body weight exercises like squatting, push-ups, jump rope, jumping jacks, walking or running or jogging, or climbing up and down stairs, all these things are example for weight-bearing exercises or weight-bearing activities. Whenever we do weight-bearing activities, that will put load on the bone, that will stimulate the formation of the osteoblast, which is the bone forming cells. That's how the density of the bone can be increased. Number two, resistance training. Whenever we do resistance training, it not only increases the bulk of the muscle, it also exerts a load, that is tensile load on the bone, that will stimulate the formation of the bone forming cells or the osteoblast, and that increases the density of the bone. Another one is dietary intervention. So diet that contains calcium and vitamin D is responsible for increasing the density of the bone. It can be used for preventing the osteoporosis. At the same time, it can be used as a treatment for the osteoporosis also. So these are some of the conventional treatment, that is weight-bearing exercises, resistance training and dietary supplements that can be done to prevent the development of osteoporosis, at the same time to manage the osteoporosis. Have a good day. Bye-bye.